Hey there, it's Naota Hashimoto, Dr. Hashimoto here with Mike Rozenblum, Dr. Mike Rozenblum. Thanks for coming. I know he works with a number of our clients on spinal decompression. It's something that isn't that new in chiropractic, but there's a number of people that could be doing a lot better, and it's not quite as simple as, I guess, buying a table and telling people to go on it. So, can you just tell me like how you got into spinal decompression?
Yeah, I always talk about patient zero. I have a Gonstead background in chiropractic, strong philosophical origins, went to life. And, we thought we could fix everything with an adjustment. And I knew about spinal decompression for about a year and a half until I finally implemented it. And it was due to a patient who went to the neighboring state, had a flare up of her low back, went to a doctor, did decompression, and she came back to tell me about it as if I didn't know it existed. She goes, Dr. Mike, you'll never believe this, but my back flared up and I went to see a doctor. And I want to tell you about this technology because you obviously don't know about it. It's called spinal decompression. And I'd known about it for about a year and a half, but I was so prideful and so hesitant to expand my horizons. And that week, after that patient, I ordered my very first spinal decompression table.
That's pretty cool. It's kind of, I got into my first modality actually through a patient. I treated
Yep.
patients out of that and he got a laser treatment, told me about it. And he was so confident he wanted this laser so bad. He
Yeah,
actually said that I'll give you the money to buy it. You pay me back at this interest. And then the catch is, I get free treatments for life because they wouldn't sell it to him, but they would sell it to me.
yeah.
So
I
it's like,
love
that's,
that.
and then yeah, obviously it took off like gangbusters. Patients got better. We added a lot of revenue. And then I was like, oh crap, I got to get a decompression table. Then I got to
Yeah,
get
that's
this.
awesome.
And then it just took off from there. And then obviously like people with like neck and back issues, most people think of like herniated discs, bulging discs, and sciatica, but like we did it with pretty much any patient with neck and back pain. Even like we'd put them on like 5 visit protocols and that helped a ton. Like it's more than just for like radiculopathy, right?
Yeah, yeah. The majority of us learned about decompression as like, well, if you're a chiropractor and you got people that are just horrible and there's nothing else you can do, try decompression. And that's just faulty thinking. I think it's a poor approach and it's not good for our patients and it's not good for our clinics and our quality of services that we render. We always tell our doctors, if you implement these bundled services into your clinics, you're going to enjoy better clinical outcomes, better overall results with your cases, and significantly better revenue. So, yeah, we learned it wrong, even myself. And you're right. We recommend decompression to probably 90% of our patients. If there's disc degeneration, stenosis, whatever it is, spondylolisthesis, there are relative contraindications to spinal decompression. We always want to be smart and be at the top of our game, but variety of patients, I mean, a majority of patients benefit significantly from a three-dimensional approach versus a two-dimensional approach.
So tell me the three-dimensional versus two-dimensional. So what do you mean there?
It's a great question. So in the chiropractic space, I'll kind of move back here a little bit. We give adjustments that are predominantly P to A.
Yeah.
Sometimes the vertebrae may get rotated or wedge. And so that's a two-dimensional correction along the X and the Y. I mean,
Yeah.
X and the Y and the Z axis,
And the
right?
Z-axis, yeah.
Yeah. But decompression addresses the Y axis, and decompression helps increase the vertical dimension of the joint. And that reduces pressure on the nerve or irritation on the nerve root. And so patients naturally understand this concept. And I do all the reports in my clinic, and people are like nodding their head, like, yes, this sounds like exactly what I need. And of course, we teach our people to overcome objections like the difference between say upside down therapy or inversion therapy versus decompression and things like that. So spinal decompression is awesome because it's so repeatable and scalable.
Yeah. Like people asked about inversions. I always said like that was fine, but I just said it was different, right? Because it's gonna be the way I was taught it was like a straight pull versus with decompression, your muscles relax a little bit and it's gonna pull directly more on the ligament.
Yeah. Well,
So
it's really interesting that you mentioned that because what happens in reality, if you study a little bit of neurology, you realize that when a patient goes upside down, your paraspinal muscles actually contract. The last thing that happens is this. That's
yeah.
the last thing that happens only about several hours when you run out of neurotransmitter and the muscles are so tired, they're like, okay, fine, we'll relax. But when you typically go upside down, the last thing that's happening at the spinal level is that it's somehow opening or stretching. So spinal decompression actually utilizes a harness, or if it's a different type of device, but there's actually a force that is a controlled force that's pulling the vertebrae. Because if I just take somebody and hold them by their ankles and put them upside down, there's no decompression, or there's no traction or no separation happening at those joints.
So it's like, I know there's a few people out in the space teaching like spinal decompression and teaching that kind of like niche care. Like, like I've sent, like I know you've worked with some of our clients and like, they like you and they're happy with you, which is the reason why you're here. But it's like, I don't know what exactly is different. Is it like hands-on? Are you customer intimate? Are you going into their office? Or like, why do they like you better than XYZ consultant?
That's actually a great question. I think that the thing that separates Pro 17s is our intentionality behind clarity. I believe strongly that a confused mind always says no. And so we teach our doctors and their staff and whatever people are part of their team, we give every single person an individual role, but we really focus on great communication. And when you communicate clearly and reasonably, typically the outcome of that is a closed transaction, right? And so that's ultimately why we do this. So I think that what separates us is that number one, I'm super hands-on. I know, like, and trust every one of my clients. They become my personal friends, and we're not for everybody. So like, we don't just say, okay, pay a fee, go on a website, watch the videos, good luck. We do utilize technology to be able to do some of our training, but the bulk of it, the real applying our principles to your practice, that has to be accomplished in a very personal level, because I have some clients that have like one or two staff, and I have some clients that have 30 staff. So obviously the implementation of our concept is going to be different, but we're not going to teach anybody anything that they've never heard before, right? If I say that a three-dimensional approach is better than a two-dimensional approach, I didn't invent that, but we just bundle that data and information together with the ultimate goal of helping our doctors and helping them help more patients. Like, I don't do decompression just because it's profitable. I do decompression because I get a better outcome. Patients, I survey my patients when they complete care. I say, well, what do you think was the best part about your treatment in our office? And I can't tell you how many people say, man, that machine, the pulling, the decompression.
People love it. People
People
love
love
it.
it.
Like I have patients fall asleep on there like all the time. They
Yes.
get so relaxed.
Yes, and we use it as part of our maintenance program. So maintenance care is not just an adjustment, but it's an adjustment bundled with decompression therapy. And so they begin to slowly understand that, yeah, there's a real clinical benefit to this, and they're willing to invest in their health and pay for it. Many doctors think like, oh yeah, I'm just going to offer decompression. I'm going to say, hey, patients, we now have decompression, as if the patient knows even what that is. We tell our doctors that patients and people in general are desperately wanting to be led. So when they come into our offices, they don't know what they need. They come in because they have a problem, right? And so we, as the expert doctor, step in and we go, Mrs. Jones, I've had an opportunity to examine you, look at your imaging, do this and do that. And based on the condition that you brought me, here are my best recommendations. And so whatever it is that the doctor recommends, that's what the patient now knows that they need. But I've never had a patient call me, or maybe once a year, somebody says, hey, do you do decompression? I want to come in because I want decompression. They don't know what they need. That's our job to explain that to them.
Yeah, market the ailment. But so when people start with you, do most of them have no equipment or do they usually have equipment? And do you just work with whatever they have or do you recommend certain things?
Yes, great question. I would say about half of our clients don't have decompression therapy in their office, and they want to introduce it. And then the other half of our clients are people that, I shouldn't say half, but a majority of our clients, they have a decompression table. They bought it 1 or 2 years ago. It's sitting in the corner collecting dust, and they're like, yeah, I should probably figure out what to do. Some of our clients, and these are the ones that are the really a lot of fun for me to work with, are doctors that are understanding the power of scale. And once they introduce our systems into their office, they transition from, one table that they sometimes recommend and use to now having two, three, four tables in their clinic. And so, but a good portion of them, we're almost having to clarify why the benefits of decompression. And so the very first thing that we do is we try to identify their space and their budget and what it is that's important to them. I don't care what kind of table a doctor has.
So
We don't.
they don't got to buy one of those like $80,000 tables or anything.
No, absolutely not. In fact, I have actually my own private opinions about which tables are sort of the best value for the money. There's some tables that have a really small footprint. So, and then not only that, but based on your chiropractic volume, you may need to start with like more than one table. So the idea is that you complement chiropractic, right? There's no substitution. The adjustment is amazing. And deep down in my heart, we're chiropractors at heart. But in 2025, there is a better way to serve patients. And that's really what we try to promote to our clients.
Got it. And then is there like, obviously you might have like certain plays. Are there certain people that aren't, you mentioned some people aren't a good fit. Is it like if someone sees like 100 people a week, is that a good fit? Is
Well,
obviously if they
yeah.
have like 3, 4, 500 visits a week, there's a ton of
No,
patients and that's
no.
easier.
Thank you. That's another great clarifying question. To me, a good fit is where you are in your mind and where you are in your heart. Obviously, the name Pro 17s comes from a verse in the Bible that says, "A friend loves at all times, but a brother is born for adversity." That's Proverbs 17:17. So the name of our company is Pro 17s is based on that verse. And what it means is this: if your practice is doing great, you don't need any help. But if you're encountering some challenges, you need family to step in. And that's the role that we want to fill, right? We want to come in and help during adversity and change the narrative and change the circumstances so the doctors can start to live better lives. So to me, not a good fit is someone that's either so slow that they like have no staff, like one person operation. I practice out of my car or I practice out of a clinic and I have no staff and I see two or three people a week. Boy, that person's in a real jam. And now if they're really willing to implement, and if we have the right conversations and they commit to taking action, there's a possibility we may take those people on. But again, it has to be the proper fit. Now, doctors who know everything already, not good fits. Because if we get on a call and you're not doing what you want to be doing, then respectfully, you need help. And I'm not an expert in everything, but I do consider myself an expert in this space. I've exited hundreds of times in chiropractic situations, whether I bought a clinic and flipped it and sold it, or part of a group, or did consulting. And so the idea is that we just want to make sure that we align just as professionals and as people. And then once that happens, then we engage and we want to earn every single dollar that we get paid by our clients. In fact, we have a 10x guarantee, in which is this: we will 10x your investment with us within the year, or I will stay with you for free until we do. Now, we've
That's
never had to exercise that, but we're really confident once we accept your case, so to speak, as a clinic, if you do what we tell you, you're going to get good outcomes, because this works in Florida and in Costa Rica and in everywhere in between. You know what I mean? It's the same concept.
so is there like, like if they're seeing 80 or 100 a week, 100, like maybe they're not, let's just say you have someone that's not struggling, but they want to serve more people, serve
Yeah.
them differently, obviously increase their revenue without beating up their body. Is there like, obviously the more patients you have, the less marketing you have to do. Like, is there like a number where you feel like, hey, your base is big enough to not?
Yeah, the national average visits a week is about 100 visits a week. Some sources say 85, some say 100, but it's about 100 visits a week. I think that a doctor that doesn't have decompression therapy, if they implement decompression therapy, even at that volume, could see their revenue increase by 15, 18, even $20,000 a month every month. And that's an increase, not a total. So we ask doctors, how many people a week are you seeing and how much money are you collecting? Because you'd be shocked. There's guys out there, and my heart breaks for them. They're working, they're in their clinic doing notes till 8 or 9 o'clock at night. They're seeing 50 or 60 people a week and collecting $12,000 a month. And you go, oh my gosh, that's a horrible existence. So if anybody's anybody knows anyone that's in that situation, like they desperately need help and they don't know what they don't know. So perhaps, having a kind of come to Jesus meeting and saying, well, do you want to close your office? Or do you want to like implement strategies that are going to help you live the life that you deserve as a chiropractor that went to school for 8 years and it's $300,000 in the hole? So yeah, very much like 100 visits a week. I think you're ready to start generating additional revenue and even less because you're talking about taking the average fee of service, right? Like the average, what is the term that they use? Like the patient visit average financially from like $40, right? To 180, 190, 200 something dollars. And so it changes the game completely and it does not require extensive additional work from the doctor or the staff. Like there are systems that you can implement to easily manage this without creating a whole bunch of disruption. And many doctors think like, well, how am I going to do this? Everything's going to have to change. Well, that's true, but it's really not true. What you're doing is imagine learning something that's going to make your clinic better. Like imagine wanting to know what people's spines look like. And so you decided, even though you've never had one, you're going to buy an x-ray machine. Everything has changed, but everything hasn't changed. You're just providing another service that creates a different outcome. And so that's how I feel about decompression and shockwave and laser and all of these complements to the chiropractic adjustment. They have value that helps everybody improve. And so that's the reason why we put together this system. And we just want to do it in a way that resonates in the hearts of all of our clients. Like if this doesn't make sense, then don't call us. But if this sounds like it's reasonable and something that you can go, gosh, I feel like I don't have to compromise my character, my integrity, my values, my technique. I don't have to compromise anything. I've discovered a better way. There's nothing ever wrong with a better way.
Is there like a couple common mistakes people make when like doing decompression in their practice?
Oh, yeah, there's several. A lot of times they think it's going to happen by itself. Like I've seen doctors tell me, yeah, every time when a patient comes in, we do a tour and we show them our decompression table. I'm like, oh my gosh, I can't even believe that. So the table doesn't sell itself. Nobody comes in asking for decompression. I would do very little, if any, decompression marketing at the beginning. I would leverage your existing patient base. That's your lowest hanging fruit. They already know, like, and trust you. And so, for example, we give our clients a letter that they can set if they're implementing decompression into their clinic. We give them a letter, and basically it says, hey, Mrs. Jones, I just want to let you know some exciting news. I've gotten some additional education and I went to a conference and I've discovered this revolutionary new non-surgical technology that has helped many people avoid neck and back surgery. It's called spinal decompression. I was thinking about your case and the fact that we've been having trouble kind of getting good results with your condition recently. And so I wanted to invite you for a complimentary evaluation and maybe a new set of films to see if you qualify for this amazing new technology. Boom. You do that letter or you make a phone call like that as the doctor to your existing patient base. It's instant. And just like I tell you that not every doctor is a good fit for Pro 17s, not every person is a good candidate for spinal decompression. So put them through the process, right? Do a consult, do a history. I tell people almost right away, I go, look, I'm willing to accept your case, but you have to understand this is not a weekend project. This is going to take several weeks to be able to stabilize your spine because you brought me a moderate to big problem. If you brought me a little problem, it would require a little solution. But because you brought us a bigger problem, it's going to require a little bit bigger solution. And so we build value. We do that from minute one, day one. Start building value. So by the time you get to the close, so much value has been built that the patient's like, well, duh, I figured it was going to cost something because we've been building value all along the way. So I think doctors deserve to be compensated fairly for their knowledge, for their experience, and for the difference that they can make in people's lives.
Yeah, no, it makes a huge impact. Patients like it. And I just remember like running the numbers, like if, like just tell it to our clients, like if they collect like if they see 120 visits a week or something like that, 125, if they work 50 weeks a year, I think it's like if it was a $5 increase in their office visit average, I think it was like 30 something thousand. If it was
Huge,
$15, it was like
huge.
96,000 or something like that. But it was like a lot of these docs, like they're charging 30, $35, and insurance, the reimbursement keeps going down lower and lower. And eventually, if people wait too long, they're not going to be able to even buy a piece of equipment, even if it's one of the cheaper tables, and they can't
Sure.
change.
No,
They,
absolutely. Listen to this number. And this is this. I just saw him at the recent event that we were at, but I have a client who I facilitated the purchase of his practice. We do some added private services like help broker deals and purchases and things like that. But I helped this young guy buy a chiropractic practice. When he bought it, he was averaging between 23 and $30,000 a month in collections, just mostly doing adjusting, E-stem, a couple of therapies like that. Well, he joined our program. We brought in a decompression table. He bought a pulse wave unit and kind of bought a lower end LED, therapeutic LED light. He's been with us, I want to say 6 months or so. Last month, July, he collected 80 grand.
that's
This
great.
was Dr. Mike. I took home $55,000 last month. And like his entire rest of his life is different. And it's
Oh,
the
yeah.
same guy, same clinic, different systems, different services, way better communication. But it's like, that just makes me feel so awesome because he happens to be an amazing young man. But like nobody talks enough about those chiropractic stories.
And it's huge, right? I
It's huge.
remember I cranked getting out. My wife and I, we paid off our student loans in our third year out of practice, and like that weight off of your shoulder is huge. But like I played a lot of baseball. Like we've talked baseball because your son did like college baseball and stuff
Yeah.
like that. And yeah, I was always looking for a coach. Had a coach when mentor in school, had worked for a mentor, got out on my own. He still mentored me, but he suggests I had a couple other people say, hey, you need to go pay for a coach. And I did that. And that's the only thing I've ever known. Like when we started a software business, I didn't try to figure out on my own. I went out and found a coach and then
So
kind of
good.
like learned everything I wanted from that one coach because I wanted to learn one thing. And someone referred me to a current coach, and he's working with me at different things. And it's just, like, why wouldn't you work with someone that's going to take you there faster? Like, and it would have, I'm pretty confident I would have gotten to where I was in practice eventually, but it would have just taken me a lot longer.
A lot longer and it'll probably cost you more.
Oh,
Like
yeah, way more.
myself have a coach. When we started Pro 17s, we hired a smart guy that knew about marketing and internet and all this other junk we didn't know. And I mean, he charged me a buttload of money, and I'm so happy that we paid him because he earned every bit of it. He saved us so many mistakes. He taught us how to think differently, how to operate and function differently. And he still coaches me today. So if Tiger Woods can have a coach, then I can have a coach and your people can have a coach.
I think Tiger had like 20. So like all kind of coaches, right? Yeah,
Right.
the fitness
Right.
coach, the diet coach, the golf coach, this coach. But he had a whole freaking team around him.
Yeah, exactly.
Tiger
Exactly.
Woods he was a different breed,
He's a
definitely.
different animal. Yeah.
Different animal. So
Yeah.
like, do you have a website or like how
Yep.
do people get a hold of you?
So the best way to get a hold of me, the best way to see how this even works and if it works is to go to pro17s.com. That's Pro17 and the letter S. So pro17s.com. And then embedded in our what you can kind of look at some of the stuff in our website. It's a very simple and easy to understand website. And then there's a little green button that says book a free 360 practice analysis. That's how everything starts. So by booking a 360 practice analysis, like I said, it's completely free. You'll get some information to fill out a survey and give me some data points about your clinic. And then we'll schedule a call and we'll find out, hey, this is going to feel really organic and natural and it makes sense, or it's not. And so I think that the smartest place to start is by booking a 360 and getting on the phone, getting on Zoom, finding out what your biggest concerns and problems are. And can we provide a logical and reasonable solution? And that's how we do it.
Cool. Well, thanks for coming on. You have a good rest of your day. Take care.
Thank you. Bye bye.